listening to the Pharmacy Podcast Network.
The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Callori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts.
Hello, everyone, and welcome to the Cardinal Health Counter Talk podcast. Welcome back. I'm your host, Jason Callori, and today we are talking with Jacqueline Eide, a pharmacist owner of Goldendale Pharmacy in the great state of Washington. A graduate of Washington State University, Jacqueline has been in Goldendale for 15 months. Previously, she spent 12 years working in corporate pharmacy at a regional chain in multiple positions, both at a store and corporate levels. Also, today we have Cate Ronalder, pharmacy operations manager here at Cardinal Health, an experienced practice manager with an impressive history of working in the insurance industry, skilled in pharmacy benefit management, pharmacy automation, pharmacy patient counseling and management, and the lead pharmacist for our Navix RX program here at Cardinal Health. Jacqueline and Cate, welcome to the show.
Hey, Jason. Thank you.
So, Jacqueline, how's the great state of Washington? I got to ask.
It's lovely. I absolutely love Washington, born and raised here. And was previously in the greater Seattle area, and now I'm in rural Washington, which is very different than the Seattle area, but still just as gorgeous.
So tell us a little bit about your pharmacy, Goldendale, and how many patients, some of the programs that you've implemented in the last several years, especially some of the stuff that you've been doing within MedSync and also compliance packaging.
Yeah, so Goldendale's small town. We've got about population of about 3,000. And so we're pretty rural out here. So the access to care is a little bit different than, say in a larger area. And so I've been here for just 15 months, so just over a year. And in that year, we've really worked to increase access to care, but specifically around helping people to take their medications better, which as pharmacists, we all are aware of the benefits of MedSync and how that can help us in our workflow, as well as making sure patients are getting the best care possible. So it's been a bit of a whirlwind in a really short amount of time, but that's what we've been doing here.
Are the majority of your patients kind of in an older age bracket, or what's the clientele of your patients and demographics as far as age wise?
Yeah, age wise, we have a pretty full range. We've got it does skew a little bit older, but we've got lots of families in town as well. And it's pretty much our pharmacy, and there's another retail pharmacy that's part of the hospital in town, but that's about it for the town. So we see a little bit of everybody.
And when we've talked to pharmacists in the past, a lot of the challenges have always been, when you're starting something new in the pharmacy, it could be a little bit overwhelming at first, especially when a lot of pharmacists are just kind of used to doing the things the way that they're used to, without really realizing the benefits of a compliance packaging system or a MedSync system to help their patients. And even sometimes the patients on their side might have a little trepidation as well. So from your experience, what was that transition like? What was it like to implement it? Was it as hard as you thought? And how has it really benefited you and the customer?
It was as hard as I thought it would be. Yes, trying to change perception, especially when something's been done the same way for 40 years, it's really difficult to do. But we got the team rallied around it, which was fantastic. Our team really saw the benefits to our workflow first, and that was the first hurdle to get over. And once they saw the improvement in workflow and that they didn't see the same patient picking up one prescription every day, they saw that patient once a month, and the lines at the counter getting shorter, that really started to build the momentum. And then once the staff's behind it, with the relationships that our staff has with all of our patients, they're able to have those really personal conversations at the counter and say, hey, can I take care of you? Can I help you get your medications all together? Because we are rural, we have people that do have to drive a pretty far distance just to get to our pharmacy. And so, helping with saving on gas to get to the pharmacy and things like that, our patients have come around really pretty quickly. And then we add the compliance packaging on top of it. And that has just kind of been the cherry on top to the MedSync program.
Yeah. So can you kind of draw a line through the difference between MedSync and compliance packaging, how they're different and how they work together? I think that's a question that I've heard multiple times.
Yeah, so the MedSync program in itself, it's fantastic because patients get all of their medications on the same day each month, and everything's ready for them when they come in. We're not waiting for the doctor to call us back or waiting to order something. It's all just there. So, but that's still in 15 different bottles that they still have to sort out and manage when they get home and make sure they're getting the right medicine at the right time. So then when we add the compliance packaging piece on top of that, specifically with Navix, it's the strip packaging. So, each dose is in a little pouch that the patient can just rip off and get just what they need for that dose, and in not having to sort through all of their pills or have a family member come in to fill up their med boxes every week, things like that. So having that extra little bit is just been really helpful, especially for some of our elderly patients that get a little confused.
I always like to ask our guest pharmacists that come on about maybe a quick personal story that they may have about a specific patient that they may have helped or maybe had to coerce them into, jumping on something a little bit new. Can you remember a specific patient that you helped out with either MedSync or compliance packaging or both that you think was a little bit surprised at the after effects?
Yes, actually I can. We have a gentleman who maybe was not wanting to change his normal way of doing things, but his daughters don't live locally and weren't around to help him out with his medications on a regular basis. And they were getting really concerned. So they came in to talk to me, actually without Dad, and to see what we could do to help him out with his medications. He was getting all of his medications through mail order. Some of them weren't coming on time, and it was just a mess. And so we were able to get all of his meds transferred over to us, and we got him on MedSync. And then we did put him on compliance packaging as well. And, the first month or so, he's like, well, this isn't going to work. I need my things the way they were. We also have him on our delivery program, and the first couple months he came in every single day looking for his meds. Well, they're not quite here yet. We're going to get them to you. Well, this isn't going to work. I need them today. Well, we'll get them there. And now we're 3 months in, and it is working so smoothly. He's taking his meds when he needs to. He's got his over-the-counter meds, his supplements, his aspirin, all in his compliance package together. And he just takes each dose as needed. And we've got him on delivery, and his box shows up on his door with our team each month. And he's just been thrilled with the change.
So that's the key. You gotta get the kids involved. You gotta kind of gang up on them, and then he finally changes, right? Pretty much, yeah. And in terms of compliance, not only to the patient, but what does compliance mean for the patient but mainly for the pharmacist and the pharmacy? What are kind of the biggest changes that you've seen, and how important is it to a pharmacy to keep those patients compliant?
It's been so important. It helps with, all of our metrics that we're all trying to work on. So to decrease the DIR fees and improve ratings. It just really helps to make sure that patients get all the medicines they need. It helps me as a pharmacist to be able to check their profile and actually look at it one time thoroughly each month instead of quick checks here and there. When I'm checking a prescription, if I've got a med sync and I have everything right in front of me, it's so much easier to think through all the different pieces and make sure that we've got the statin if they're a diabetic and all of those important things.
That's great. Cate, I want to kind of transition to you a bit. You've been pharmacy operations manager here at Cardinal Health. You're kind of heading up our Navix RX solution, and things have been going really well. I got to personally go down to Texas and see the entire operation, but from a compliance packaging standpoint, I'm just curious to get your perspective. How important is for those compliances and for the patients and for everyone and for the patient and for the pharmacist behind the counter, the staff workflow? How important is it to have systems like this implemented?
It's tremendously important. It's one of the reasons that this program is really special to me, because someone like Jacqueline doing this for her patients wants to be able to provide those compliance packaging and the strip packaging and those other offerings, but it's almost financially and space-wise and all of the different support pieces impossible for them to bring that in and then compete with all those other offerings out there to be able to provide the best for their patients. So for Cardinal to be able to offer this to their pharmacies is tremendous for them to be able to compete and be able to offer the best to their patients.
Now, Navix works a little bit differently than maybe what Jacqueline had been speaking about a little bit. Can you explain a little bit of the workflow of Navix and how it works? Because it is a pretty amazing system from front to back.
Right. It's a central fill option that also not only does it provide that compliance packaging piece for the pharmacies, but it also helps with that work balancing, taking some of that physical filling piece of the workload off of Jacqueline and her team so that they can provide other offerings and other clinical support to their patients. And we're taking care of that, getting the medication in stock for us, putting it in the packaging, putting it all together and getting it back to the pharmacy so that they can get it delivered to that patient. So we work within their pharmacy management system so that they can go through, do their DURs, do all that clinical review that is amazing importance with their patients to keep those star ratings and things that Jacqueline mentioned, and be able to provide that clinical piece. They send through their PMS to Navix. We fill that and then ship it back to them via FedEx so that it is there and ready for them on the day that they need it to deliver.
Jacqueline, back to you. Because you've been able to open up a little bit more time for you and your staff, have there been other opportunities for you to branch off and do some other things within the pharmacy because of the improved workflow?
Yes, it has. I have actually been able to assist. We've got a state grant that helps us with COVID testing. That we're able to provide that. And also I am able to provide some clinical services to our patients. So I can help to ease the burden of healthcare access around. So I can see patients here for things like urinary tract infections or yeast infections. And so I can expand clinically as well and expand what we're offering here at the pharmacy by freeing up that time.
That's awesome. Cate, that's really the goal of what you're doing with Navix too, is to kind of free up that time and make sure that everyone is taken care of and expand some more operations within each pharmacy.
Absolutely.
Cate, tell us a little bit more about the implementation of Navix and how that works, because I think, again, going back to what we talked about with Jacqueline just earlier, I think some people get a little bit muddled into, what happens when you're trying to implement one of these new systems into your pharmacy. But, from your perspective, how much of that has improved and gotten easier over the last several years?
I'll kind of reiterate a couple things Jacqueline said that kind of keyed for me, that we tell all of our pharmacies, if you can get a patient to commit to 3 months of trying the compliance package and trying the change, they'll see the benefit. The first month, is always the most difficult change month. The second month, they're like, okay, well, it's still not going to work for me. And by the third month, they see the value. Having your team 100% behind it and understanding what value it brings to them. But it's that understanding that it may take a couple of rounds of getting that box and seeing how easy it is for them to dose and be able to take it. And then the caregivers, as in Jacqueline's patients that she mentioned, those daughters were probably much more confident in their father's healthcare and knowing that they can look at it. Is he taking his medication? If he has enough medication to get to the end of the month, or well, if he's calling me a week early, is he not taking it as it is? It's much easier for caregivers and clinically to be able to monitor what he's taking.
Jacqueline, I'm going to go back to you real quick. If you could give the listeners any tips or tricks or maybe some lessons learned for implementing whether it be MedSync, compliance packaging, or both, what are some of the hurdles or maybe some of the things that you wish you knew before you implemented to maybe help someone get started?
I think on the MedSync thing it seems really overwhelming before you get started. And so I would say start easy. Sometimes we want to sync up our most complex patients first because they obviously need the most help. And so don't start there. Don't start with the patient with 15 different medications. Don't try and sync that. Start with a really straightforward patient, maybe somebody who's got 3 or 4 medications that actually is pretty much already synced up, and get those tweaks worked out with kind of simpler patients. Make sure your workflow, everybody understands your workflow before you start expanding it into bigger, more complex patients.
Well, that's definitely good advice. Catherine, with your experience, what advice would you give to some pharmacists that are looking to possibly implement this into their pharmacy?
To implement compliance packaging is understanding your MedSync, getting that into place, but also understanding that compliance packaging can be in different manners. The Cardinal offers more than just Navix RX with the bubble packing with, as well as strip packaging, that every patient needs some kind of compliance and direction, but making sure that you tailor it to the patient as they need it.
That's awesome. Well, real quick, guys, just to let everybody know, Navix RX, you guys can definitely check out Navix RX on cardinalhealth.com, read all about it. And I think we have a special offer, from Cardinal Health. I think it's 50% off your fills for 3 months. The first 25 customers who sign a Navix RX agreement and place at least one patient fill by January 31st of 2023 will receive half off pricing for 3 months. That's just $9 per month per patient fill. So a good deal to be had there. I want to say thanks again to both Jacqueline and Cate for their valuable time, and to everyone out there for taking the time to listen to the Cardinal Health Counter Talk podcast. If you're not a subscriber yet, please find us wherever you listen to your favorite podcasts. And thanks to our partners at the Pharmacy Podcast Network. I'm Jason Callori, your host. Thanks to all the independent pharmacist listeners out there for everything you do for all of our patients out there. See you next time right here on the Cardinal Health Counter Talk podcast. Take care, everybody.